were introduced by function, location, one or the other, I would study them that way. I think they're easier. Now, if you find a better way, by all means, do that and then enlighten me to help somebody else in the future. I'm perfectly happy. However, I think the quads, the hamstrings, and the adductors are all pretty simple ways to go about grouping the upper leg. Internal, external rotators get a little hairy, especially on internal rotation, but we can work with that too. Certainly the compartments of the lower leg, that makes prime, rich, happy question time. What muscles go in each compartment? Good? And I always guarantee you that this little new anatomy piece that they have labeled in the that goes right there.
What? Not even an MRI.
Dude, talk to your dad. I don't know. What's he been doing? Like, have you challenged him on that? Like, yo, dude, what's up? How come I'm learning about new anatomy? I'm a little sketched out. My surgeons don't even know what's there. It's like I'm doing heart surgery. Like, you sure you know what's in there? Cook the right stuff when you do this kind of stuff. All right. So, anterolateral ligament of the knee, ALL. Remember it, it will be there. I'll have a whole army full of people that know it exists.
Oh, yeah,
You're not really going to be like, what is it? Wow, you are mean today. You're wearing your nice tie. What is this?
That's what happens when you don't get to run anymore.
All this energy was supposed to be burned off yesterday. I'm supposed to be sore and hobbling today.
Well, you're not, so deal with it.
Yeah.
10 points off that oral exam grade.
Whatever.
Oral exam grades. I'm finalizing those today, so they will be posted by the end of the day.
Sweet.
So,
Can't be that good. It's just taking me that long to do it. It's gotta be pretty cool.
Well, apparently I didn't do it.
The last set did not
you
take
got 10
that
points to
long.
take off, which means...
Cool. From 100, I got 90.
All right.
I was going to be doing the breakup question of
I would know them. I haven't decided if they're on there yet. I haven't written the test yet. Usually people like the drawings because they're easy points to know.
Are you going to give us extras for color coding?
Actually, yes. If you color code your pictures, I will give you bonus points. Because, well, let's see if I even have the drawings on there. But it just makes it easier to grade because I can see things broken down easier. It makes it so. I'm happy to reward first grade coloring. So, okay, so. How do you start? Start with the bones. What bones are there? We're talking lower extremity. What begins the lower extremity? Pelvis, right? So pelvis is made of how many bones fused together? 3. What bones are those? Ilium, ischium,
Pubis.
pubis. Good. What is the articulation point between the spine and the pelvis, between the lower extremity?
Good.
Somebody who's committed to an answer.
Spine and bar.
Say it?
SI joint.
SI joint, thank you. So, from the spine to the pelvis is the sacroiliac joint. So the sacrum, triangular piece, fits in with the two sides of the pelvis. It's kind of the keystone of that archway, right? All right, so then from the pelvis we have, what's the articular surface of the pelvis for the hip joint? What is it called?
Pubis.
Acetabulum. Good, so the acetabulum is the socket for the hip joint, and we have the femoral head that fits in there. Through there is a small artery that connects the two pieces, so it has its own identifiable blood source. Dislocated hip usually means ruptured artery. Probably not such a good day. So, femur goes down, articulates with what two bones? Tibia and fibula. Which one takes more weight when you're walking? By how much? A lot to a little. Good. So,
Like 90%.
yeah, it's like 8 to 10% is all the fibula takes. What is the function of the fibula then?
Rotation.
Somewhere.
Ankles to go in.
6, 8. What's that?
Attachment.
Attachment. It's muscle attachment. So you have lots of muscle.
That's its function, muscle attachment.
Play back the videos. I always. Also attachment.
All right. So coming down from there, we've got tibia here. Fibula is hiding under there, all the way down, and that gets us down to the lovely ankle.
Da, da, da.
Ankle, fun. So give me some ligaments. We've got 3 main ligaments that control and support the lateral aspect of the ankle. What are they?
ATF.
ATF,
TFL.
CF,
ABC.
Binder gets down there. PTF. Anterior talofibular, calcaneofibular, posterior talofibular. You should know that for ortho too, because that will come again.
What was the third?
Posterior talofibular.
ATF, PTF, and CTF.
So,
See.
I'm gonna go to class later.
anterior talofibular, right there. Calcaneofibular right there. And then PTF is going to sit deep in the back. So we have retinaculums that kind of help tether the ligaments down, the tendons down. So what muscle is that? Well, I've got to get a highlight for you. So we'll do it this way. That one right there. Okay, and that one? Longest, cool. So that makes that right there. What structure?
Perennial.
Superior.
Retinaculum.
So retinaculum, yeah, so it's the inferior extensor retinaculum, inferior perennial retinaculum. And it comes across to be the inferior extensor retinaculum, and there's the superior. So bifurcate ligament, where is that hiding? Under there somewhere.
Little one. It's in that little gap.
Right about
There.
there. Found it. So if you're doing palpations trying to identify it, you've got your ATF there, and the bifurcate's the next set of joints up here. Why do I care about the bifurcate ligament? Because I need more questions to ask you on an exam.
Wow.
Usually what gets sprained. When you sprain your ankle.
So if I brace somebody and the brace does its job and they still roll their ankle, we spare the ATF and that load's going to be transferred somewhere, and very, very frequently it's going right here to the bifurcate ligament. Come back. Cool? Cool. Everybody loves it just as much as me. All right. Let's talk about arch. What are the 3 main ligaments that support the medial longitudinal arch? Spring, which is calcaneonavicular. There's actually 4 main structures that we'll go for. So spring ligament's one.
Definitely have the strongest one.
Which is the
Calcaneonavicular is a spring ligament.
Back
On the
end.
medial side?
That's it right there. I'll make it flash for you.
Wow.
Deltoid?
No.
That's in your.
Short plantar, which is hiding down under here. Long plantar is going down under there. And then what's the last one? So spring is the highest up.
Wow, I said deltoid.
Short plantar, long plantar, then what? The somewhere in the middle plantar. The plantar fascia.
Do short and long go together? So that there's no
Oh, I lied, there's 4. So, spring ligament, short plantar, long plantar, and then we have the plantar fascia, which will run all the way across. then that will be the plantar fascia will be the most superficial.